of cancer that are otherwise preventive. Let's look at HPV. The government worked, I think, 2 years back to actually roll out a campaign to encourage persons and actually parents to have their children vaccinated against HPV. From where you sit within the value chain, has it been taken up?
I think there has been a moderate uptake. However, some of the challenges that exist have really been around myths and misconceptions. And that's really part of the, we did talk about the financing, but we haven't talked about one of the major barriers to access to care, which is really the socio-cultural barriers that exist. And this is because quite a number of myths and misconceptions have been associated with HPV, whereas we know that most people, most adults, certainly by the time ladies getting to, most women getting to 50 have had at least exposure. 80 to 90% of the population have been exposed to HPV. But what happens is that for most people, they're able to clear that. They're able to clear the virus successfully. However, it's only in a certain cohort where it actually progresses to cervical cancers. However, when we talk about HPV vaccines, there's always that, is this going to maybe encourage indiscriminate sexual behavior, or are we having a judgment call around sexuality? So we really need to start to have these conversations in open spaces. We've known from the data that HPV does not necessarily increase your risk of sexual, partners or whatever, but it's looking at, if you look at the risk versus benefit, because people sometimes have worries about fertility, or will this affect my fertility? None of that has actually been proven, and we do know that the vaccine is safe and it does reduce the risk of cervical cancer in people who've been vaccinated by up to 90%, and this is a largely preventable illness. And so really, in terms of looking at how do we strategize around this, it's not just a health perspective, it's really around education and empowerment, because as much as we're talking about demystifying and stigmatizing some of these, it really comes down to what is the literacy level in the population. Again, beyond literacy, what are the patients able to understand, or what are the population able to understand about the benefits? But beyond that, how do they then have the agency or economic wherewithal to actually access care? Because it's not just enough to have the HPV vaccine, you do need to go for screening. But then that then brings in the case, how do I then prioritize screening? Because one, is it our health-seeking behavior? Because as you and I know, Regina, sometimes the narrative that we have in many of our communities is, why am I going to look for trouble?
Yes.